Thanks for joining us, everyone, for the A to Z Masterclass preview event. This is the most powerful masterclass that I've ever done. If you enjoy this preview and want more, you are going to be amazed with the A to Z Wellness Masterclass. It's the first docuseries of its kind. The A to Z Wellness Masterclass has 17 lessons broken up into 40 videos which spanned over 12 hours. In this masterclass, we will review every major condition in the human body and how the medical system views and treats it. And then we will be showing you our way, nature's way, for those of you who wish to take back their power and become the masters of not just their bodies, but their whole life. We've got your answer. The day that you no longer consider yourself a patient and hope that you're going to get well, you will become your own practitioner and know that healing is inevitable. Brace the future of health because it's here. Midnight, New Year's Eve, the first 1,000 who join will have free access for life. This is the answer that you seek. Become the light for your family today. God bless and enjoy the show. And just know that we have live Q&As every Friday at 3 p.m. Pacific Standard Time, where you can send in your questions on Facebook, YouTube, and Instagram, or ask them live on all these social media platforms the day that we do the Q&A at 3 p.m. Pacific Standard Time on Fridays. And if you want to send your question in anonymously, you can do so on the docofdetoxshow.com website. God bless everyone. Let us help you unleash the authentic you today. Good day, everybody, and welcome to the International Training Institute of Health Masterclass. Okay, this is the first masterclass that we've ever done where we're going to show you that thought form becomes physical form. This masterclass is for who? It's for anybody 6 years old to 106. And I'll tell you why. Because how would you like to not walk around inflamed? How would you like to not walk around limping or have to know that you're part of the majority where you're going to go have to get surgery at some point, which you don't? And how would you like to not be like most of the majority and be on prescription drugs where they have to numb you down and dumb you down? Understand something. I want you to watch this show and to challenge us and to see how we are going to be bringing to you a new paradigm shift about the physical body, and how 99 out of 100 of all surgeries that happen do not have to happen. They're preventable, except that what's happened is the system has become a machine. The system does not have a beating heart. It does not have feelings. It has a bottom line. And we're going to show you how you can take your power back, okay? And how you can become the light for your family. We're going to show you how the medical system would treat something, and then we're going to show you how we would treat you, and how we will give you a guarantee that if you ever come for treatment to us, that the first time we do any of our body work, whether it's Wolfe Deep Tissue, or whether it's Wolfe Non-Surgical, or whether it's Wolfe Facial Sculpturing, that in the first treatment, we will do more for you than all other treatments, or we'll offer you a money-back guarantee. Now you're going, well, why would they offer some money-back guarantee? Because when you introduce something that's never been introduced before, and people do not understand the power or the validity of it, we need to put ourselves on the line so that we can deliver to you something that's going to take you out of the dark ages of what we would call a physical body in pain and suffering and disease. And we're going to show you how we're going to reverse that today, aren't we, Abby?
Yes, very excited to share everything with you guys. It's groundbreaking, the therapy we do. So should we get to it?
Yeah, and just understand something. Sage and Abby, okay, they are master trainers. And I just want to set the stage properly, okay? They go all over the world. they go to people's homes, they go to people's clinics, they certify practitioners, okay? You know what? I know what you're thinking. Wow, they look young. And I will tell you something, okay? There's a genius in a baby. There's a genius in all of us, and we want to hand that over to you, and we're going to show you that, okay? Abby and Sage travel all over the world, and they'll go into people's homes for 5 to 10 days, or they'll go into clinics and certify practitioners that have been practitioners for 30 and 40 years. Yeah, you hear what I'm saying. So understand something. It's all about the power of the technique and the power of the mind and what you do with that technique. And that's what we're going to show you today. The first thing we're going to be doing, though, is we're going to be talking about how thought form creates physical form. This show, okay, is going to be where we're showing you how to work on the whole body, right, Sage?
Totally. But everything starts as an emotion. So we want to go into the invisible before we actually work on the physical.
That's right. And we're going to show you from the tip of your nose down to your toes. We're going to go through every major joint, every major condition that you end up having to take drugs for or have surgery, and show you that 99% of those can be prevented when you decide to take back your power. And the power would be the mind, because where the mind goes, the body follows. And you better get this, because your personality has created your reality on whether or not you've had heart disease, whether or not that you've had a tumor right now, whether or not you've got arthritis in your hands, migraine headache, TMJ problem, a hearing problem, eyesight, or diarrhea or constipation. These are all got to do with your personality, and your personality is based on your beliefs. And those beliefs, you can believe it or not believe it, but you can do your own research. But the beliefs that the majority of the population has, and I do mean majority, like 9,999 people out of 10,000, their beliefs, the negative beliefs, are 70 to 90% of them. And your subconscious mind rules you. Your subconscious mind is 90% of your brain. Now, understand something. The only time that you've ever become the master at anything, whether it's good or bad, is when you've repeated it 10,000 times. Because until you repeat it 10,000 times, it doesn't become a prominent thought. So that is where you need to take a deep breath with us, get into your lion heart breathing, take 6 seconds in and 7 seconds out, maybe even hold it for 1 or 2 seconds, because that's called 0 point, the present moment. And you need to calm down, and you need to say, I'm going to take the time to watch this whole series. I'm going to take the time to watch every show. Because especially you men out there, you don't even know what your position is, because you don't have to go out and kill any animals to bring food home, do you? You don't have to protect the home against anything. Yes, you do. You've lost your place. You should be protecting your family. You should be learning how to do this deep tissue technique, and you should be learning on what makes a healthy family and unhealthy family. That is the job of a male, and males are lost today. So wives, I know you're going to try to sit these guys down, and they're not going to want to learn this because they believe that you're the caregivers, but they're the protectors. And unless you have somebody in the home that's going to hold the loving line and learn this, then nobody's going to be safe. Nobody's going to be safe from what's out there and what's coming for us. So, what do you think, Abby?
I think you're 100% right. This world is getting crazier and crazier. Things are getting more intense. Everybody's going to extremes. What is it? 1 in every 3rd person is struggling with an autoimmune disorder now. And it's all reversible. It's all healable, and you are the healer. So
yeah. So we got 1 out of every 3 women get cancer. 1 out of every 2 men, okay, will be getting cancer. Okay, and it's actually 85% of the population has autoimmune disease now. One third left actually 5 years ago. So you can see we've hit the tipping point right now. And understand something, if you don't want to become a statistic, then you better learn and do what everybody else is not doing. Mm-hmm. Okay? There is no more time to follow the herd. Okay? So let's begin with this, okay? So what I said was, I said that thought form creates physical form. So that means that your thoughts matter. So understand something. The image that you hold for yourself, your family, for the world, for your life, is what you're going to create. Whether you want to believe this or not, okay, you're not even 1% physical. The main part of you is energy, and that's scientifically proven. If you go into our other videos, we're not going to go into that really deep today, because trust me, make sure that you go and watch, okay, the 4 steps to the perfect day, okay? And go watch that, and then you're going to understand what I'm talking about. But today what we're going to talk about is this, is that every thought that you have, every prominent thought that you have becomes a belief.
Yeah.
Every belief becomes a program. So it starts off like this. You want to go down to the beach, you got to make a trail through the bush, so you got to work hard, right? But then what happens, you keep walking it, it becomes a path. And then more people take it, or you keep taking it, it becomes a road. Then it becomes a highway. Then it becomes a freeway. So understand something. Your prominent beliefs want to be fed.
100%.
And they'll run you.
And your programs create your health or your illness. So what programs do you really want to run?
Yeah. So you're going to love this one, guys. So your prominent beliefs need to be fed. And you're going, what do you mean they need to be fed? Well, guess what? You spend at the most 5% of your day in the present moment. The other 95% is being programmed, okay? At least I'm being programmed. I program myself to be in the present moment, okay? My thoughts are mine. Nobody rules me. Nobody schools me, okay? So what I'm trying to say is this. You take a look with anybody that has a disease. Did you get that? Anybody that has a shoulder problem, an elbow problem, a hip problem, a fibroid in their pelvis, calcium deposits in their breast, a lung problem, a sinus problem, losing your hair. All of this started off as a thought first that went to an emotion that you repeated enough that went to a belief that became a belief system. So now guess what? If you had the belief that you totally loved yourself, you'd have total health. Okay, this morning I talked to a gentleman, and he runs one of the biggest clinics, natural health clinics, in North America. And he's been going through my information, and he said, you know what? I have never heard of anything like this in my life. And just even thinking of totally loving myself is a selfish act. And I said, wow, how old are you? And he told me, and he was just over 50 years old. And I go, well, it's time to change, isn't it? Would you like your children, okay, to love themselves 10%, 20%, or 100%? Well, of course, 100%. Then what's wrong with you? We won't go into that today. So now, these beliefs, your prominent beliefs, if they're positive, they're creating a foundation for you from the minute you wake up until you go to bed. It's called pleasure. It's called joy. It's called happiness. It's called when things go wrong, they don't go wrong. It's a part of the adventure. But if you've got beliefs that are dysfunctional and based in negative, when things go wrong, you break down. But here's the deal. What did I tell you? I said your prominent beliefs need to be fed. Now, what if those prominent beliefs were negative? They would need to be fed how often? All the time. And what do beliefs become? They create a problem of dis-ease, not at ease with self. So understand this. Here we go, and I'm going to say it quickly and efficiently, but I told you, go watch the 4 steps to the perfect day if you really want to get a handle on this. So here it is. You have an image. The image becomes a thought. The thought becomes an emotion. The emotion then is a frequency. The frequency triggers the chemist, which is the brain, that releases the hormones and the chemicals. You have chemicals and hormones that spell HAC, because you're always trying to hack it up, get that hairball out, okay? And that would be histamine, adrenaline, and cortisol. That's hacking. You're always trying to spew something out, some orifice, because you're always in pain. Or if you had a loving, unconditional thought for yourself, unconditional love for yourself, then what you're going to be is you're going to be triggering what? A daily dose. Daily dose, D is what? Dopamine. O, oxytocin, S, serotonin, E, endorphins. And that's how this game is played. And if you did that, you wouldn't have any pain in the human body. And if you did, you would understand that pain is a friend. Pain is a GPS. But no, you got taught to attack pain, which means you're attacking your body. And that's why 85% of the population has autoimmune disease, because autoimmune disease means attacking one's self. You are not crippled, you are not dumb, and you're not stupid, and you're not cursed, and you're not a sinner. So get over it and start really embracing what you are. You're a light energy being. So now these negative beliefs are going to need to be fed. So guess what? What do you think is the most prominent part of you? The disease that you have. And the disease that you have is now eating you. So the belief that you used to feed is now feeding off of you. And welcome to pain and suffering till the end. And there is not, a pharmaceutical company that doesn't love you right now. They all love you because you are running negative emotional beliefs, because thought form becomes physical form. And when you hate yourself, I don't hate myself. Well, you're only running love, or you're running hate. So if you're running a hate program, then you're going to be sold off by the pound. Oh yeah, I got to go for surgery. I'll lose a piece of this and a piece of that. My father had 13 operations. He had 3 heart operations. My grandmother used to show me and pull up her dress even and show me all her scars. My family believed that if you got a piece cut out of you every 3 years or every couple of years, that you'd live forever. And that piece that they were trying to cut out of them was the rot that was in their mind. Because listen, you've got a landmine. You're not the master of your mind. I absolutely believe nothing that I hear out there. I absolutely believe nothing from anybody. Okay? Unless it's based on total, unconditional love for oneself and this planet. And it's based on getting back to nature, because everything has spirit. And until you find your spirit, okay, then you're going to be in pain and suffering. What do you guys think?
In our day and age, it's just people are constantly looking externally to find themselves, to fill themselves up with other people's emotions, crappy food. And the answer is actually just stop, take a step back, get into your breath, and start looking inside. What do you truly need? What do you know that is actually going to benefit your body? Stop going with the herd and with everybody else, because you're getting programmed, because that's what is out there. It's all about almost imprintation of just everybody doing the same thing. Stop being like your average Joe. Why not be your unique Jen and just do your own thing? Start eating correctly. Start living life the way you deserve. And that's starting with self-love.
Yeah. So it really comes down to this. Whose program are you really running?
Yeah.
That's the deal.
Because it's not yours.
If it was your program, you know what? You would be living a life of joy. And if it was your program, you would be allowing people, when it's their time to leave the planet, like the indigenous people, when somebody was leaving the planet, they would have a celebration.
It's a celebration of life. You're letting the spirit go.
Our biggest words are disease, death, dying, divorce,
hate.
But they're all those D's. And you know what? They've been implanted into you. So it really comes down to programs.
Totally. And every program is a living thing. That's how you have to look at it. Everything in this world is living. So if you have these negative programs that you're running, you're needing to feed all of this negative energy into it.
Ask any alcoholic.
Yeah.
Ask any smoker. Ask any vapor. Ask any heroin addict.
Ask people with food addictions.
They need their fix.
Yeah. And if you said to them, listen, don't you know you're killing yourself?
Yeah.
And what would they say? Yeah, but you know what? My reality is my personality isn't good enough for mommy and daddy and everyone else. So I'm trying to become someone else. And because I know I'm not worth loving, I'm actually killing myself to show everybody I understand I'm unworthy.
And the bigger the thing is, the more it eats. So just think about how big some people's programs get.
Yeah, so is your negative beliefs the size of a dinosaur? Okay. All right. So you'll know. And you'll start knowing because you're moving so slow, because the more negative beliefs you run, the less energy you have. And understand something. The more energy you have, the faster you heal. The more energy you have, the more you can love. And we can't live without love. It's like oxygen.
Totally. And one other thing too, with programs and with them creating all these physical blocks in our body, right?
Issues in your tissues.
Everything starts from that energy. Everything starts from that. It triggers that emotion, and that emotion triggers all these physical blocks. So you're actually, when feeding these negative beliefs and negative programs, those physical blocks that are attached to those are growing bigger and bigger, leading to things like fibroids, scar tissue knots, tumors.
And understand something, you know, like we said already, you have to have an emotional block before you have a physical block. That emotional block is you blocking off of loving yourself, you judging yourself. The biggest thing you can mistake you'll ever make is judging yourself and others. Observe and learn, or judge and burn. And you're burning up your body. Every time you do that, you're dumping the acidity right into your system. And then you got to pull on the calcium. Then the fibrin has to be made for the scar tissue to wall it off. And the crystallization. And then your energy comes down. So like Abby was saying, you're creating everything physical from a pimple to a tumor. And understand something. The one thing is, some people think a fibroid's a tumor, but it's not. A fibroid is a massive scar tissue, where a tumor, what does it need? It needs to be fed. It steals your nutrition, and it blocks nutrition from the rest of your body. And we're going to teach you in this course that it doesn't matter whether it's arthritis in the joint, okay, or whether it's adhesions in the abdomen, whether it's
a tumor on the TMJ.
A fibroid, or it's a tumor on the TMJ. Sage is working with a patient right now. And or whether it's fibroid in the breast. They're all scar tissue. Even a tumor is mainly scar tissue. And you're taught not to touch it. We want to lovingly take it apart and lovingly ask it to leave the body. Right?
And that's the thing. Everything with love.
Everything with love, and everything with self-love, unconditional love. And you know what? I want you to think about what I said earlier. Don't think that you're ever going to totally heal unless you totally love yourself, unless you let yourself off the hook. So understand something. This is where you're owned, okay? And you're going to give yourself away with this one. And you got to create your own game, right?
How many blockages do you have though in your body? People don't even realize what's going on, and really, how warm are you? And warm by do you have circulation? If you don't have circulation, if you're constantly cold, then that's just a wake up call right there immediately.
Cold hands, cold feet. Yeah, you're so right. And understand something. And what we do is we teach you how to bring up your circulation, okay, and bring up your temperature, because that's what we need to do. Is we need to melt the
everything
ice
down.
Block. Yeah, if there's an ice block in you on an emotional and physical level. And on the emotional level, it's dysfunctional beliefs. On the physical level, it's scar tissue, crystallization, and calcification all come together to create these blocks. And like you just said, Sage, a cancer patient doesn't have one block called a tumor, okay? They have 30.
15 to 20 at least.
Yeah, well, the average person that has arthritis has 10 blocks, and we find them. We go throughout the body, and remember,
they have blocks here. That means they got it in their forearm. They got it in their elbow. Everything starts to slow down. If you got one big blockade, the dams just start creating along the road.
That's right. And yet, if there was beaver dams all along the river, that slows down the water. That slows down the flow, which slows down the oxygen and nutrition from getting into your cells. And remember, your blood cells, well, guess what they are? They're ferry boats of light. And if you don't get the light into the mitochondria and into the DNA, because your DNA give off light 24/7, your mitochondria feed on light, which makes the ATP, which creates the energy. So do you see what we got going down here? So for every block you have, you're slowing down the flow. So what we need to understand is, and I know that there's a lot of people out there going to have a little bit of trouble with this, okay? Because they're going to say it's hormonal, or they're going to say that it's this and that. And well, I just want to tell you something. Most of what you know about your health is incorrect, because if it was correct, you wouldn't be suffering right now or in pain, or you wouldn't have all those drugs in your cabinet in the bathroom, and you wouldn't be thinking about the next appointment, the next treatment that you need. So let's make something really clear here. From a pimple to a tumor, and every issue in your tissue, from your nose to your toes, is you not being able to process some type of emotion. You are actually giving a platform that doesn't work, okay? And that platform, meaning that you can't process your emotions properly. What happens is, when you can't process an emotion properly and let it go, or make peace with it, until you're ready to deal with it, it gets stored in the human body. The human body, it actually is the storyteller of your life, okay? All right? And you can go back and you can rewrite your story by changing your personality, by changing your most prominent beliefs. You're going to change your personality. You're going to change your reality. You're going to take and change thought form. You're going to change physical form. So understand something. Unprocessed emotions need some place to be stored. Right from a pimple to a tumor. And guess what? That if a tumor's getting larger, or the arthritis is getting worse, or the colitis is getting worse, or the migraines are getting worse, and you've tried all these supplements and all these treatments, understand something. It's a scar tissue issue, and it's also an emotional issue of you putting yourself on the rack and torturing yourself and believing that you're unworthy to be healed. Yeah, I need you to understand that if you have a disease for more than a few months, on a subconscious, unconscious level, that is now your best friend. And if I said that to you, you'd say that's not true. And I will tell you that any belief that you've had for a few months, and what do you talk about the most? Okay, what do depressed people talk about? Depressing things. And what do they take? They take things for depression, drugs. Now, what do people talk about the most that have inflammation in their body? The inflammation and the pain in their body.
Yeah.
What do people talk about the most when things aren't going their way? They're always talking about how things aren't going their way. Because you are the creator of everything, and you need to mind your own business. And your own business is minding your thoughts and understanding something. Whatever you have grown in your body, if you don't want it, if you change your frequency, your vibration, it has to leave. That's universal law. And I'm going to tell you right now, forget man's laws. I don't want anything to do with man's rules, whether it's health, whether it's government, whether it's anything outside there. Okay? I don't need any of man's rules, because when you unconditionally, totally love yourself, you are going to do things not to harm yourself or others or anything else that has spirit, which is everything on this planet.
That's literally it, though. Like, clock it. Like, your prominent beliefs, the things that you do, your pain in your body, clock it. See when it's occurring.
Calendar track it.
And see what's happening in that moment to actually activate that emotion or that feeling or that pain, and see how often that happens and what is reoccurring for that to happen. And you'll be surprised. It's probably going to be the exact same thing over and over.
And so tracking yourself is the best way to change your life. When you can track what you're doing, whether it's your thoughts, your food you're eating, the pain you're experiencing.
You're allowing that stuff to surface so it's visible to you, and you're like, now I can take action. You're now
aware of it. Yeah. And you're like, hey, maybe that thought triggered me to eat that food. And hey, look, I had really bad inflammation the next day.
But here's the problem. When this happens, you're in your subconscious and you're not even aware of it. Unless you're going to buy into the Braveheart 12 loving steps and buy into Lionheart breathing
and the perfect day
and live in 0 point, which is the present moment most of the day. And for most people, they'd have to set a little bell on their phone to go off every 5 minutes to start reprogramming you. It's never going to happen. And if you want the gold, then you would come and take our whole life coach certification, even if you're never wanting to open up a practice, or if you're running a practice and it doesn't seem to be going the way you want, because we guarantee that we're going to show you this.
It's taking your power back.
Yeah.
Take your power back. Yep. And I will tell you right now that even the largest percent of the natural health practitioners out there aren't practicing this. When you go to see a practitioner and when you go to see someone, do you ask yourself, are they vibrating high? Where is their frequency? Okay. Do they honor, respect, and love themselves? Because you can't give what you're not. So what we're trying to teach you is, if you honor the biggest part of you, which isn't the invisible part, you'll never have to worry about the physical part. But even if you decide to change your mind, change your diet, okay, change the way you live, understand something. The issues in your tissues are beef jerky. They've come over time. So we will lovingly show you how to do this for yourself and your family. So the biggest thing is we don't understand that we've become beef jerky. You know how grandpa is walking and he's stiff as a board, and you go, Grandpa, are you in pain? I don't feel a thing. Well, guess what? Between the drugs, between the scar tissue, between the displaced calcium and the crystallization, it is totally cemented all his nervous system, because he could no longer stay in pain, because as long as we're having pain, the energy is leaving our body. And the longer and the more deeper the pain, the bigger the dis-ease. Welcome to cancer. Welcome to autoimmune disease. Welcome to heart attack. Welcome to stroke. Welcome to Parkinson's. Welcome to MS. Welcome to all of these things. All right? So understand, when you start to get a stiff joint, okay, anywhere in the human body, or you become twisted because of scoliosis, or you get torticollis, which is wry neck, okay, or you continually have a sore throat, all of this is inflammation creating scar tissue. And eventually your body's going to create enough scar tissue, you will not have any pain in that part of your body. But guess what? It's in big trouble, because now the vibration's really low. And these are the areas we see tumors growing. We see boils. We see cysts. We see fatty tumors. Hey, how am I doing here? Okay? So understand something. I will have people come to me and they'll go, I have been eating well for 10 years. Everything is organic. And I'll go, yeah. And have you done the mind work? Some have, some haven't. Okay? But then I'll go, and have you ever had deep tissue? Oh, yeah, I've had deep tissue. No, you haven't. Okay? And I'll go, let us do a treatment on you. And I promise you that knee, that wrist, that shoulder, that toe, okay, that spine, in the first treatment, I guarantee you that we'll give you 60 to 80% minimum relief. One treatment where we're going to go in, and you have to understand what happens here. Okay, first of all, let's say this is your muscle tissue. So all your muscle fibers have blood and lymph, and they have invisible energy flowing. Oh, that invisible energy would be you. Okay? Now, what happens is continually living in fight, flight, and fright causes us to freeze. And when we freeze up, we contract. And when we over-contract, okay, those fibers come tight together. Then eventually, because they're coming tight together, the light, the blood, and the lymph cannot get around these fibers, cannot get the blood cells in to drop off the light, the nutrition, the oxygen, and get the toxins out. They stick together. They start sticking together. And then guess what? Dehydration comes in. Oh, because everybody thinks they drink water. They don't drink structured water, that's for sure, most people. And, we won't get into that issue right now. But the reality is, the drier that this gets and the less light that comes in here, this starts to shrink and comes up, and it comes up into a ball. I've got a knot in my neck. I got a fibroid in my breast. I got a fibroid down in my groin. I can't move my joints. My fingers are now starting to close down because everything is shrinking. So even like an inch, if it was an inch thick of muscle, that would come down to maybe a quarter inch or less because it becomes dehydrated. All we're doing, people go, well, where's all the crystallization going to go? Where's all the scar tissue going to go after you've worked on me? What if I have a heart attack or a stroke because of it? No. when we let the light in, which is in the blood, and we allow the nutrition to come in and the energy to flow, because even the invisible energy gets stopped by a block, instantaneously that beef jerky goes back to new, healthy, vibrant, young tissue, just like that. And you tell me that we don't heal at the speed of light, and I'll tell you, you don't know what you're talking about. And here's one thing I do want to talk about, and this is really important you take this home. The whole medical system says they do not believe in the energy body. Okay? Who are they kidding? All of their equipment that tests you to see if you have cancer, to see the bone density that you have, to test your blood, is all testing your energy, your spirit. That's right, your vibratory level. So they don't believe in energy medicine. They don't believe in the energy body, but all their equipment tests the energy body to find out what physically is going on with you. Let me tell you something. Go check out the Hippocratic Oath, where they say they will do no harm. It's not in there anymore. And the other thing is, I want to say something. The only thing left of that is the hypocrite. Don't you dare tell me that you don't believe in the energy body, and then tell me that you're going to use equipment that tests the energy body to find out what's wrong with the physical body. What do you think, I was born yesterday? Okay, and the reality is this: if they ever did admit to it, well, that would be the end of pharmaceuticals, and that'd be end of about 99% of all surgeries. And this is where we're standing, and this is why we're making this video today. Mm-hmm. This is why we're coming out to tell everyone that this needs to stop, because the implants of a new hip, a new knee, okay, and the screws and the plates, unless it's totally needed, cannot be done, because it's a foreign object, and it will continually create poisoning and inflammation, scar tissue formation, crystallization, and mutation in your body. But understand something. If you totally unconditionally loved yourself, you wouldn't be going to surgery. You wouldn't be taking the drugs. And you're going to go, he doesn't know what he's talking about. Well, guess what? I think you forgot who created you. And you've been disconnected to that for a long time. Even if you tell me that you have faith in some religion, I'll tell you that you've lost your connection to the Spirit, because the Spirit knows all, the Spirit heals all, and that's the bottom line, and I'm sticking to it.
Yeah.
Yeah.
And the biggest thing too is, as that was amazing, you covered a lot of things in that little spiel there. But I wanted to just touch on the inflammation and the pain and everybody's GPS system, and how they're just completely ignoring it. They don't even pay attention to their warning signs of the pain and the inflammation, and then it's leading to all this scar tissue formation, this crystallization, and this displaced calcium.
But they're not ignoring the pain. You're wrong.
Well, they're shutting it down with drugs.
There it is. So they're not ignoring it. So guess what? Pain is your friend, but for you, it's your frenemy, right? Mm-hmm. And the reality is, if you attack the pain, you're attacking the human body, which means you're running a hate program. Yeah. And you bought into a hate program, you don't even know it. And guess what? Pain is the greatest teacher and your GPS on a physical level. Mm-hmm. And on an emotional level, it's your imagination. Mm-hmm. Your imagination is the greatest thing that you could have. But guess what? When I was in school, I got a good slap beside the head. Darrell, stop daydreaming. Well, guess what? I'm never going to stop daydreaming. It's my dream. It's my game. And I'll dream whatever I want, and I'll dream so big. And that's why we're here today. If I didn't dream this big, all right, and if I didn't know who I was, I'd be scared to talk about this. Or I'd be scared about thinking what you're thinking about. A lot of you watching this right now, you're going, he doesn't know what he's talking about. But I won't take it personal. I won't take it personal that you don't understand your body. I won't take it personal that you don't love yourself. I just want you to know that I'm here for you. And if you ever want to buy into this, okay, drink the Kool-Aid of unconditional love, right? And really learning how to look after this physical body. This is why we're putting this series together, right?
Exactly.
Yeah. It's honestly, it's going to be life-changing if everybody can really honor themselves, love themselves, and really just own it and take their life back, because that's what it's all about. You need to stop listening to outside sources, like Sage was saying, not looking externally for this love, for that self-love, and look within and really do the things that are going to help to heal your body and what's going on in the world today isn't working.
Just know your personal worth. Like, you can go to the hospital and buy a prescription drug to buffer down some pain you're feeling in your body, or you can actually dig into that pain and figure out what caused it,
I'm
what
excited
emotions
to share
attached
this
to
with
it,
everybody, right?
and let's
Because a lot of
pull it
people
apart.
don't know what we can do and what we can offer them. They think that maybe that is their only choice, right? So this series is just going to be so amazing to just open that door for everybody to understand that they do have other options that aren't going to harm their bodies.
And understand something. Anything that you push away pushes back. Don't try to push away pain. Okay? Just connect to your breath and breathe, and then close your eyes, and then picture light all around you and in you. Just give that a shot and see what happens. And then take massive personal action at how to master the mind, because where the mind goes, the body follows.
Yeah, you have to rewrite your story. That's what it comes down to. You can rewrite your past, you can write your present and your future, and create the perfect day.
That's right. And guess what? And you're going to go back and you're going to write the story the way you wanted it. If you were physically abused by someone, sexually abused, if you were neglected, okay, if you feel that you weren't loved, use your imagination and go back to the first time that you felt that arrow go through your heart. Because you don't understand this, but from 0 to 7, that is when 70 to 90% of all the dysfunction in your life took place that you're running with today. Even when you're in mommy's womb, okay? Because for most children, because parents don't realize that pain and suffering is not a part of life, the womb is called the womb of doom for most children. Parents don't realize that we pick up those vibrations, and
you're
that
connected to your mother. Like,
right.
you are connected to your
and we'll prove
mother,
that
so
when we
you will
show you.
feel everything. You pick up every frequency,
really
every emotion.
Exciting about the personalized treatment and training, but it's the perfect pain-free pregnancy that we do. And honestly, this is so foundational and so important for every single couple who's wanting to start a family, because we actually will come in and train you on how to have the right emotions going through your body, flowing through you and going into your baby. We're going to train you on the right nutrition, the deep tissue to prepare your body to have a pain-free, perfect pregnancy. Yes, the non-surgical. And we're going to train the husband on how to work on the mother and throughout her entire pregnancy. It's absolutely
think about
amazing.
Getting through the pregnancy and not allowing trauma and drama to create an adrenaline rush that exhausts you, and then you end up saying something that you don't want to say or do. Think about you as a man. You're not the one with the child, but you have now a big part to play because you've learned how to do the Wolfe Non-Surgical, and you can actually go in and open up her low back, her spine, her pelvis,
her hips.
And you can get rid of any pain she has, any muscle, any joint in the body, and you can give her a pain-free pregnancy instead of just sitting on the side going, football starts at 8. Okay, so understand, we need to take massive action, because to be able to bring a child into this world, we should be so humbled and so honored. And when they get here, understand something. They are your teachers. You are not their teachers. Anyways, we're going to come back to it, but understand something. Everything starts off as a thought. So thought form becomes physical form. And we are an inflammation nation. And the media, the government, the pharmaceutical companies run both of them. And they know that the more stress they bring into your home through the TV, through any type of news, okay, that's going to cause you to do the things that feed, okay, their belief system, which is so hungry, it'll eat up your whole family before you even wink an eye. So when you bring love home and you bring health home and you make your home into a true castle and you empower your family, that's what this series is all about. And we're going to show you that, aren't we?
Yes, very excited.
Thanks for joining us, everyone, for part 1 of the International Training Institute of Health Masterclass. We'll see you in part 2, and make sure that you have your pens and papers in hand because the training has just begun. Welcome back, everybody, to the International Training Institute of Health Masterclass. And today we're going to be talking about the pelvis. And we're going to be talking about it in the way that we know it, and we call it the pelvic clearance. And that means that this area of the body needs to be cleared out on an emotional and a physical level. And of all the places in the body, there is not a place that is or has such dysfunctional emotions locked in, locked down. And understand something. Every time you bury an emotion, or every time you can't deal with an emotion and you bury it, you get issues in your tissues. And when we go through all the different things that can happen in the pelvis area, you're going to see that this place can become a landmine, because you know what? The more important that a part of your body is, the more it needs to be respected and honored. And we also know that when it comes to the pelvic area, emotionally, sex is involved, and there's a lot of things that are attached with it, like, sex is dirty, I used to sleep around with guys and I feel dirty, or I used to sleep around with girls and I feel dirty, or I got some kind of venereal disease or some kind of infection, and then we get all this guilt and it all gets penned up in there. Or you're part of some, or you were, or your parents are, or someone else that are part of some kind of religious order that makes making love and sex a dirty thing, and that even comes on to you. And guess what? Every thought, every emotion, the more negativity it has, the more issues in the tissues, the more contaminated your tissues will be. So understand, we've got to make peace. We've got to make peace with our thoughts, or we'll end up in pieces. Mm-hmm. What do you think?
Yeah.
100%. I like to think of the pelvis as like this big melting pot bowl of all these like emotions and physical trauma and sexual trauma and mental trauma. All of this just filters down and it just collects in your pelvis.
Yeah, and like, what does sex stand for? Like, sacred energy exchange. So what do you think you're doing with that person, that partner?
Totally.
So you're giving them your energy, and you're taking their energy on themselves. So it's like, who are you sharing that with, and how does that make you feel afterwards? Was that person like a lover? Was that person like, depending on how that made you feel, will kind of react on like how much stuff you're going to really bury down there and keep down there and let that affect you.
Totally. It could be a healing experience, or it could be a traumatic experience.
And you have to understand something. It doesn't matter if it's your fallopian tubes, your ovaries, your uterus, your bladder, your prostate, your testes, or, the other guy. The problem is when you've got a problem, it is usually an emotional problem that turns out to be a physical problem. That's why things keep coming back. Yeah. And even if you take drugs to suppress the emotion that was locked in the tissue, you're going to have a bigger and another issue somewhere else, because that's called energy exchange.
Or you're just pretty much boxing that emotion away until something triggers it again for it to be set off.
Because it's called a sleeper.
Exactly. That sleeper is just sleeping right now, and all you need to do is have one little thing for it to be set off. And that drug that you're taking as well is going to have its own things attached to it in its own.
But the drug will numb out the thought for a while, and it will put it to sleep, because it numbs your brain, it numbs your nervous system. You don't feel a thing, right? And then one day, one happening, somebody says something, or it's a smell that somebody you were traumatized with, or the name, or just something brings that up. And you're going to find that usually those traumas, the main ones are from 0 to 7. The secondary ones are from 7 to 14. And you got to go back and rewrite history. And when it comes to your pelvis, I'm telling you, you've got to clean out the issues that are infecting those tissues.
Definitely.
Yes.
And it can lead to a lot of major problems, which is what we're going to get to right now. So for women, some of these major problems that can occur in the pelvic region are fibroids, ovarian cysts, endometriosis, pelvic inflammatory disease, and PCOS. So that's what we're going to be covering here in this first episode for our pelvic clearance. So let's get to it. We're going to start with some fibroids. So fibroids are abnormal growths that develop in or on a woman's uterus. Sometimes these tumors become quite large and cause severe abdominal pain and heavy periods. In other cases, they cause no signs or symptoms at all. The growths are typically benign or non-cancerous. According to the medical system, the cause of uterine fibroids is unknown, but research and clinical experience point to these factors for higher risk of fibroids. Women of childbearing years, when estrogen levels are higher, being overweight, hormonal imbalances, birth control containing estrogen. And the medical treatment for fibroids generally includes medication to regulate hormones and surgery to remove the fibroids. And then for their aftercare, the medical system will ask you to monitor the condition. They'll suggest taking some pain medication when needed, anti-inflammatory medications, and hormonal medications.
Well, you know what, honey? I went to the doctor. They said that the surgery went good. They got it all, but they didn't get the belief. So it's coming back. You know what, honey? The doctor's going to give you something to kill the pain. And then guess what? As that fibroid grows, it'll be big enough that they can take it out. But guess what? Sometimes they don't catch it in time and it gets too big. And if they were to take it out, they would risk your life. Mm-hmm. So the understanding is, as soon as it's as small as a pea, you should be on it. You're going to say, well, I don't know when it's small as a pea. Yes, you do. You had inflammatory pelvic syndrome of some sort prior to this.
Yeah.
Mm-hmm.
Now, will
There was other red flags going on.
Go back and just read what they said right there.
The definition?
Yeah, no, not the definition, just the reasons why you get fibroids.
Okay, so some of the reasons why.
Oh, first of all, do you notice something? When I say the word tumor, what do you think? You think cancer, don't you?
Immediately.
Mm-hmm.
Those dirty little stinkers, you know, they use the word tumor for a fibroid, okay, to scare the living heck out of you. They're taught this, okay? Medical doctors are taught to do what they do. You do get that, right? And why would they say that? It's a fibroid. Don't call it a tumor. And every time somebody has a cancerous growth, what do they call it?
A tumor.
A tumor.
That's right. So you see how they get you, get you.
Straight fear tactics.
They tried, they're like, oh, it's benign.
Okay, that's the first thing I want to say.
They like to make you feel better with the word benign.
Yeah, this is a tumor. What? Just that alone just made it grow.
Yeah, seriously.
Okay, so that's it, because a tumor is a ball of fear. And it's false evidence appearing real that you can't deal with, that your thoughts become things. Okay, what was the next thing?
So the medical system says the cause of uterine fibroids is unknown, but research and clinical experience points to these factors for higher risk of fibroids.
I just want to say this right now. It's unknown. It's a fibroid. And what creates a fibroid? Fibrin. They don't know that when you have inflammation, the body makes tons of fibrin, and it'll keep sending fibrin to that area until the inflammation comes down. They know this. Don't even think about it. Don't even think about it. Don't even try to insult me like that. Okay, next.
So then it says, so it's more common for women of childbearing years when estrogen levels are higher.
Okay.
Being overweight.
First of all, we know that childbearing years, that the hormones are continually balancing, moving, shifting. Understand something. It is not a hormonal issue.
No.
The hormonal issue is the problem with the inflamed tissue.
Exactly.
And that is it. Okay, if you didn't have inflammation, it wouldn't be throwing you all over the place. If you had a whole plant-based diet and you had the proper nutrition and you had a peaceful mind, then your hormones aren't going to be all over the place. Oh, well, like as if, you know what, every time, okay, I'm not a woman, but if I don't watch my emotions and I get negative thoughts coming in me, don't tell me that my hormones aren't all over the place.
100%.
Listen, I've had a point where when I'm stressed out, Peter doesn't go anywhere. I'm just like, I'm flatlined. So understand something. That's where we get it. When we're stressed out, we see that. Okay, or we can't think straight.
Yeah. And the thing too with hormone imbalances, if you aren't following a whole plant-based diet, eating organic foods and drinking the right waters, you are taking in things that are going to disrupt your hormones because it is causing that inflammation. If you're taking in phytoestrogens or xenoestrogens or all these different things or processed packaged foods that are in plastic, all of these things are hormonal
Bottled
disruptors.
water. Are you kidding
Yeah.
me? You're kidding me, right? So, you know, people will go, oh my God, there's no such thing as structured water. You can't put your structure unit under any tap in the world and drink the water. Yeah, well, I don't know. If it's good enough for the rain, it's good enough for me, and that's whoever created the universe created that. But you'll go to Costco and get your big bottles, plastic bottles that you can hear them go crunch, crunch, crunch. And when you drink them when they're warm, you can taste it. You can
plastic.
taste the
Like, how long have
carcinogens
they
in
even
here.
been sitting there? You
Oh,
don't
please.
even know.
You know what? That's just like, okay, yesterday on the Q&A, we had a guy come on there and say, well, Dr. Wolfe, you say that you like to be challenged. And then he asked something that makes no sense. Where's your third party for all your nutritionals? And guess what? And I just told him that the pharmaceuticals, they lie, cry, and justify, but, you know, they switch everything around. They don't even do it right, and they spend millions. And then most women are on drugs that have only been tested on animals. And I don't recall my partner being an animal. End of story. So you know what? We get programmed, and it's like we'll actually open our mouth and say something that makes absolutely no sense. Are you kidding me?
Yeah.
Okay, let's go.
And so birth control containing estrogen as well will cause it. So fibroids, they're saying that a hormonal shift when your estrogen levels are higher than your progesterone, then fibroids can form. But this is all because of that inflammation. Even if you look at your glands that are producing all of these hormones, if they've even become calcified from displaced calcium from all that acidity over the years, they're not even functioning properly. They're not even excreting the hormones that you need.
And give me a woman that is hormonally out of balance, and I will give you a woman that has 10 to 20 physical fibroid tissue blocks that she doesn't even know we have. Now, when I say fibroid, I mean, I'm talking about scar tissue in the elbow, all kinds of scar tissue around her heart, her pelvis is a spider's web, but it hasn't been diagnosed yet.
No.
And nobody's going to talk to her about the bowel movements, because when you absorb the waste from your bowel movements, what are you absorbing? You're absorbing the estrogen that should have left.
Yeah.
And now you're retaking it in, and by taking the old estrogen and reabsorbing it back into your system, wax your whole, but nobody's going to talk about that, right? Okay, so we know that if you get somebody on our daily cleansing tea, their hormones will balance, and we didn't even give them any hormones. So what is that about? And when you start giving them proper water, whole
Humic
plant-based
acid.
foods. Yeah, and humic acid. Whoa, humic acid, so powerful at doing it. So let's not go after the hormones. Let's go after the cause.
And that's the thing. We always want to go after the root, and that's always going to come back to the large intestine.
Well, or the pelvis and the large
Because
intestine,
it's seeping.
because your pelvis is your root
It's
Chakra.
the root chakra.
chakra.
Yeah.
It's the main meridian. And then you people that are of a different faction that go, oh, I don't want to talk about meridians. Well, it's not voodoo, it's science, okay? We have energy grids in our pelvis when we have them all the way up, all right? And they're there. So you can't, and if you didn't have these energy grids, you wouldn't be able to get the sunlight in, you wouldn't be able to get all these universal frequencies in, and you wouldn't be able to get the earth frequencies into you without all of these grids. And that's it. Next.
All right. So next up, we have cysts. So
I do want to say about the fibroid. So give me a fibroid, right or wrong, the size of a cantaloupe, and we will reduce the size by about 30 minimum, maybe 40% in the first treatment.
Yeah.
Okay, come and visit us and start doing our energy medicine and go through one of our, or we'll come and do a PTT training with you and start doing the energy medicine equipment, the nutritionals, and the emotional training, and the
deep
detox,
tissue.
and the non-surgical, and we'll lovingly take that apart. And from today, this moment, you think that the end of the world's coming, okay? We will show you within hours that you've only begun to live. Okay, so everything's a thought, and guess what? Just because there's a whole sanction of people out there brainwashed, well, this is all we can do. You better go home and get your affairs in order. Are you kidding me? You're kidding me, right? Okay.
All right, so next we have cysts. So cysts are closed pockets of air, fluid, or pus located on or under the vaginal lining. There are several types of vaginal cysts. The most common are ovarian cysts. According to the medical system, vaginal cysts are caused by a trauma to the vaginal wall from childbirth, fluid buildup in the glands, hormonal imbalance, endometriosis, pregnancy, and severe pelvic infections. The medical treatment for vaginal cysts generally include monitoring the cyst for changes.
That's right. We need someone to watch it, okay? We got to get a cyst watcher. Maybe he should be an assistant. Okay, all right.
The GP, so general practitioner, may decide to do a biopsy to rule out cancer. If the cyst is large, the healthcare provider may decide to use a catheter to drain the fluid. Hormonal contraceptives can be used, or surgery. For at-home aftercare, your doctor may recommend hormone therapy.
So let's keep guess what? Me and the team, we're going to keep an eye on that for you, okay? Sage is going to live behind your toilet, and Abby's going to be under your bed. And then when we're going to have you come in again when we think it's time.
Yeah.
You know what? Where's the empowerment? Where's you taking back your life? Where's the blueprint to create that perfect day? Where is it that you forgot that you were able to heal? And understand something, cysts are pus.
Yeah.
They've got water in them because that's to dilute the what? The infection so that it doesn't explode. That's why there's water. But it's basically a pustule.
It's just pus, no.
And it's from you absorbing your own waste. And because gravity, that waste that's coming from your bowel, okay, is going down into the valley, which now we could call a death valley, okay? And then that is creating the infection, which creates the inflammation, which causes the pustule, because we got to store it somewhere, just like the fibroid, right? We have to store it somewhere. We got to store all this emotion, okay? So everything gets stored, just like your body creates fat, okay, to store toxins and to store emotions.
Definitely.
You'll get fibroids that store even more toxic emotions than fat. Fat isn't, if you look at the emotions that are in fat compared to a fibroid, ooh, these are the ones where we really don't like each other. I mean, or ourselves. This is the ones that we might even be loathing ourselves. And then the pustule, you know, we really have to take a look at everything and clean up the mind and clean up the colon first and foremost,
that's
right?
That's the most important thing. And that's one thing I would just like to mention. One of my friends, actually, she just found out she has ovarian cysts, and she had a bacterial vaginosis for almost a year without them figuring it out, but it's from her bowels. The bacterial vaginosis came from her bowels.
That's right, but you can't have a cyst
without having an infection.
And without having an infection, because that is a huge infection.
Yeah.
And do you remember? It was you. And it was the last class we did. I forget who we're working on. And she had a cyst the size of a large grape. And she said, well, can you get rid of this? So, and this was in her groin. And Sage went and worked on her. And around the cyst, you'll always feel a wall of scar tissue. And that wall is like the moat to stop the pus from going anywhere, and hoping that the patient will wake up and detox, right? And clean the colon out, because guess what? It gently gets reabsorbed back into the body and then thrown off, right? Okay, so it took, 10 minutes, 5 minutes?
Yeah.
Maybe 5 to 10 minutes, went in, worked on it, and just lovingly took that apart, and then all of a sudden, you felt it just go, boom, gone.
Disappeared.
And she went, whoa, I felt something warm.
Yeah.
And then guess what? She went down here and went, it's gone. Now, did it poison her? No. The body can handle that, okay? It can handle it. It's when people get cysts that are like this big. It's a lot of pus.
Yeah.
And we have a lot of therapies that we're going to be talking about in the pelvic clearance treatment, specifically that we can use if that does happen to help cleanse out that infection so it doesn't cause anything.
Yeah, and that was a small
go
one. If it was
haywire.
a large one,
We would for sure be doing some internal therapies to
well, we would do
cleanse.
them anyway.
Yeah.
We'd do them anyway. We're going to do the same thing with one person as we do another. We just, if we've got a 20-foot hole, we're going to use a 20-foot ladder instead of a 10-foot ladder. But the reality is we're going to still send you to the doctor. We're still going to send you to your doctor. And maybe he needs to drain that. And then maybe, you know what? We get it under control.
Yeah.
You know what? There's a time for 911 emergency care.
Yeah.
And we're never going to tell people not to go to their doctor.
Never.
We want you to know that there's an alternative and that you can actually take charge when you're ready, when you finally believe that it's your body. Okay? But up until that point, we are never there to talk you into what to do. So even if you were to ask us and say, well, what would you do, Dr. Wolfe? And I'll say, what I would do would be totally different than you because we're different. You know, right now I feel confident enough I could look after that myself. But if you don't feel confident about it, go see your doctor and do what you need to do to feel confident, and then come to us and allow us to build a protocol to prove to you that you have the power to heal. Okay?
All right. Next up, we have endometriosis. Endometriosis is a condition resulting from the appearance of endometrial tissue outside the uterus and causing pelvic pain. Because this displaced tissue has no way to exit your body, it becomes trapped. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions. Abnormal bands of fibrous tissue can cause pelvic tissue and organs to stick to each other.
Can I say something?
Of course.
I want everybody to know something, that nothing came outside. The tissue didn't come outside. It was a swelling. It got inflamed. And then the inflammation went too far, and that's when we started to get the adhesions and the scar tissue. And now we got things sticking together that shouldn't stick together. And why is the stickiness? Well, that would be the pus. That would be what we call the crystallization. And that's the glue that sticks everything together. Like, Grandpa, you look like you're in pain. Don't feel a thing. Because now he's cemented with it. Mm-hmm. Okay.
The medical system says endometriosis can be caused by a number of factors, including a retrograde period, which is when a woman's menstrual blood flows back into her body during her period, which causes displaced endometrial cells, can cause hormonal imbalances, and can cause surgical scar implantation. So that's when the endometrial cells actually attach to the surgical incision. So that can be from hysterectomies or C-sections. And then also transformation of peritoneal and embryonic cells, and endometrial cell transportation and immune system disorders. Those are all the causes for endometriosis.
Okay, so no woman's blood flows back into them. Let's make that perfectly clear. What they have is they have inflammation that causes contraction, that causes the backup of the blood. They're not going to tell you that you're in contraction because of inflammation, creating a spasm that doesn't allow the proper blood flow. So now you've got a backup of traffic, and this blood needed to come out, but because it's not coming out, now you've got blood poisoning in the uterus. Now what are you going to do?
Yeah, well, and that's the thing too. Like, there could be a lot of factors that could be causing this retrograde period. Like, they could have a lot of scar tissue in their fallopian tubes or in the opening of the uterus where the blood can't even get out properly, right? So
well, for one
it could
thing,
be trying to flow in any direction because it's just like, where can I go? I need to get out.
That's right. And if that happens, we already know that you have scar tissue, that you've had inflammation, not for weeks, not for months, but for years. Yeah. And remember something, in this condition, you've got spider webbing all through your whole pelvis. So I want you to go and take a look at a spider web next time, and you can see what's happening, and that's only going to get thicker. And guess what? Don't tell me that, lovemaking is not uncomfortable. Don't tell me that when you move, sometimes you feel like something's tied a knot in your groin and you can't really put a pulse on it, but there's something wrong. Then you go to the doctor, and then he's going to, oh, wow. It can be, look at, all I'm trying to tell you, I'm not trying to tell you not to go to the doctor. I'm trying to tell you that if you knew how to look after and love that pelvis, it would love you.
Totally. And that's the thing. You have to just show it love, even just thinking loving thoughts when you're like, I remember when
Don't
we were
hate
talking,
your pelvis.
when we were doing all the research for this and we were talking about ovarian cysts, and I was just like, looking at pictures of them and everything. I was just like, I love you. I love you. I love you. Right. You have to just show your body love, because that's how we heal, is when we give self-love to ourselves.
And you know what? That sounds so crazy. to show, like even people out there going, show your body love. That sounds sick. No, I think you should hate yourself. Oh, wait a minute. You already do. Okay, let's keep going.
So the medical treatment for endometriosis usually involves medications or surgery depending on the severity of the condition. An example of surgery is a hysterectomy with removal of the ovaries as well as the uterus. And their aftercare approach taken by the medical doctors are to usually use hormonal contraceptives or hormonal therapy and anti-inflammatory drugs. And prevention, probiotics, diet, promote healthy digestion, liver support.
Okay, and that's because probiotics really don't do a heck of a lot. They do help to turn the burner down a little bit. And I want everybody to understand something as we move forward here, that I do dramatize everything. Okay, I'm trying to get the message across to you. So don't take anything personal, but take the message home. And understand your subconscious is not your friend right now. Your subconscious believes things that are very unhealthy and life-threatening to you. That is the majority, not you. Maybe you already have it handled. Maybe you're already a master at your mind, and maybe you even know more than I do, so, or a lot more than I do. But the reality is I'm talking to the majority of the population. That's why we're doing this, aren't we? All right, because if we can, we're not looking for people to call us. They can call us anytime they want. We're not looking for people to come to us, but they can come to us for help if they want. But what we do want to do is, if they've watched this and they can walk away and say, hey, I'm taking my life back, well, there it is right there.
Yeah.
Okay, and understand something. You know what? The only time that somebody has to cut something out of you is because it's rotting. Now, why in the world would the most amazing thing that was ever created that I know of in the universe rot away? God does not make faulty things, and it's not your fault, but it is certainly somebody who, okay, all right.
Yeah. And that's the thing. We have to just look at everything as a whole. We have to see that our emotions could have caused some trauma.
Could have.
Did cause trauma down below.
I know, but she's going to say could, because we're not supposed to be so cocky. But the reality is, everything starts off from the invisible to the
Physical.
to the visible, from the thought to the thought form to the physical form. And we know that.
Yeah.
Okay?
So we really just need to take a look at our lifestyle. It's the same with everything. The perfect day, really take a look at that. Go to the library, read the Braveheart, the 12 Loving Steps. Those are really going to help you get reconnected to yourself and to find that inner child, and really go through the recall healing and the mind mapping. And
why do people say to find your inner child? Because you need to go back when you were just a little child, before 7 years old, and find out where the seed got planted, that you decided you were unworthy and that you didn't have the intelligence to master your own body.
Yeah.
Okay.
All right. So on to the next.
Let's give it a shot.
Okay. All right. So polycystic ovarian syndrome, or PCOS. The word polycystic means many cysts. PCOS is a condition that affects a woman's hormone levels. Women with PCOS produce higher than normal amounts of male hormones. This hormone imbalance causes them to skip menstrual periods and makes it harder for them to get pregnant. In PCOS, many fluid-filled, aka follicles, so fluid-filled sacs, grow inside the ovaries. These follicles, containing immature eggs, never mature enough to trigger ovulation. The lack of ovulation creates an imbalance of female hormones and a higher level of androgens, male hormones. The excess of male hormones creates changes in menstrual cycles, example, irregular, missed, or heavy periods.
Okay, so let's take a good look at this. So right off the bat, we call it polycystic, right? Well, that means that you have many cysts. So at one time you had one, but you didn't listen. Then you had two. Then you didn't listen, you had three. Then you didn't listen, you had six. So it just keeps on going until you learn that lesson. And what is that lesson? Well, you still didn't clean your bowels out. You didn't go to a whole plant-based diet. You didn't go to structured water. You didn't go to connecting your breath, okay? And the more cysts you have, the deeper the hole, the more problems. So the more male hormones you're going to have, the more hair you're going to grow, facial hair, the more male things you're going to take on, okay? And understand something. This is all about infection. As the infection gets worse, the condition gets worse, you'll get to take more powerful drugs to try to down the pain, because the level of pain is dependent on the level of infection and how long you've let this thing run. Now, this is so logical. The more pain you have, the more chronic the problem. The more toxic the emotion, more toxic the diet, the lifestyle. So you really have to take a look at this. And also, you know what? Keep going down this road if you want, but guess what? How many pieces do you want them to cut out before you're going to get this? When are you going to say, I love myself, I'm going to heal myself? Okay?
I'm curious, actually, on an emotional level, what would cause women to produce more male hormones in that? Like, why would it target that specifically in a woman?
Well, you know what? I hate being a woman. I feel defenseless. I've been raped 3 times. Every time I meet a guy, he rejects me.
Okay. Good to know. I have a few people I know who have it, so I was curious about the emotional attachment behind it.
And you know what? There could be so many other reasons.
Totally.
You know, so I'm not going to sit here as the Mr. Knowing, but the reality is I think we all kind of know.
Yeah.
You know, we just don't want to talk about it.
Yeah, I was thinking a lot of sexual confusion.
Well, that's what we're talking about. Well, sexual confusion is you're turning into a male. Well, because maybe you're disliking being a female because of the way you've been treated.
Yeah, definitely.
Maybe I need to become a male to protect myself.
Or sick of being a woman because maybe they think it's too much work or too hard or something like that.
Yeah, you know what? You got to watch out what you think. Okay? Look out what you ask for. Okay?
All right, so the medical treatments for endometriosis generally include anti-inflammatory medications, hormonal therapy, and surgery like a hysterectomy. And their aftercare recommendations is just to continue with hormone therapy and maintain a healthy weight and exercise.
Well, you know, this is the same thing that we do with a dog when we don't want the female dog getting pregnant, or it really calms them down, right? You know, back a long time ago, many years ago, if the woman was hysterical, she would go in for this surgery, okay?
The hysterectomy.
Yeah, and then we would get the Stepford wife, right? The Stepford life. But, you know, don't be asleep at the wheel, girls, because I don't know if you know this, but in executive positions in the medical field, only 3% of women have executive positions in the medical field. 97% of those positions are held by men. And when you know that there's 97% of the people that are making decisions for women are men, well, you better get your Nikes on. Okay.
Yeah. So the next one we have is pelvic inflammatory disease. Pelvic inflammatory disease.
Okay, we're just going to talk about it. We're not going to go any further with it. With the pelvic inflammatory disease, all right, we know that is inflammation out of control. Now, remember something. The pelvic inflammatory disease, the reason why we put it right here is because everything we've talked about already was pelvic inflammatory disease for months and years prior to all these other conditions. And we already know where the inflammation comes from. Okay, we talked about that already.
Yeah, it's the infection and everything.
With pelvic putrefying.
With pelvic inflammatory disease, though, there is medical causes such as gonorrhea or chlamydia. So it is important, obviously, if you are sexually active and you're not protecting yourself the way you should, make sure you are getting checked to make sure you don't have an infection, and then you can look at treating that. You can treat things naturally too. You don't need to do it the antibiotic way. And you can give us a call at the clinic if you are needing to look at doing anything for those infections, and you don't want to go the antibiotic route.
Yeah, there's choices.
And just know that, because not many people know that there are, but there are.
Yeah.
And aftercare, so prevention, safe sex, temporary abstinence until the condition is cleared. Because you don't want to inflame the area more when you already have a pelvic
or inflame anyone else.
Yeah. Well, yeah, if you have an infection, definitely don't be doing anything.
Because you know what? Life is a boomerang. Whatever you throw out there,
It comes back.
Mm-hmm.
okay. You might want to ask yourself why you have the gonorrhea. Okay? All right? And gonorrhea doesn't make you a good person or a bad person. Understand that. It's just learning how to become the master of your energy and your frequency and your emotions.
Totally.
That's all.
We
love you whether you have it or not.
Yeah.
That's it.
Stuff happens.
Yeah,
So,
trust me, stuff happens. Okay,
And-
I could tell you stories.
Well, no, the thing is it's all how you handle
We'll
it.
save
If-
that for the next episode.
The next episode,
like,
the R-rated one.
I feel like this just turned into like a late night talk show.
Well, it's starting to look like that, but everybody, don't get too overly excited because this act is done, and we'll be back at you with
Fertility issues.
fertility issues. Not an episode that you want to miss. All right.
Stay
See you
tuned.
then.